Then, of course, you can have developmental abnormalities. Definitely, this we cannot say these are this by no means is exhaustive. It's not exhaustive. These are not the only ones, but basically, I picked at the ones that are likely to be more common. Developmental is basically resulting from abnormalities during development, during embryology, and that is why it was important that we did embryology. So spina bifida mostly tend to be common around the lumbosacral region, and mostly results from, remember, when we talk about development of the central nervous system, yeah, usually there is the neurotube formation. When the neurotube is being formed, usually it tends to close from the cranial region, that is from the head region towards the caudal region, towards the tail. And so when it fails to fuse around the lower part of the body, you develop spina bifida. Of course, if those neural tube doesn't close towards the head region, you end up with what we call anencephaly. You can have with absence of the brain because the brain did not form, because this neurophore, we call it a neuropore, did not close, yeah, during development. Of course, you have hydrocephalus. Hydrocephalus basically is where there is problem with cerebrospinal fluid. There is blockage in the flow of the cerebrospinal fluid, especially in children. So you end up with increase of fluid within the ventricles, and so you end up with in a child, because the skull is not yet fused, you have an enlarged skull because as a result of increase in cerebrospinal fluid within, especially the lateral ventricles. So that's what we call hydrocephalus. Of course, in an adult, you will not be able to develop hydrocephalus. The head will not enlarge because the sutures are already fused. So you end up mostly with increased intracranial pressure, headache, and so on in an adult. And of course, we have a diagram there of a normal spine. You see the meninges, the spinal cord, the nerve, and so on. Then we have different types of spina bifida. We have one we call spina bifida occulta. So basically, this one is not obvious. When you talk of something being an occulta or occult, it is something that is not obvious. Sometimes you may just see a patient and the lumbar region, a child, you see a lot of tuft of hair growing around there, tuft of hair growing around there. And if you are to go and look and do maybe an ultrasound, you see that there is a defect in the vertebral column. So that will be spina bifida occulta. Then we have meningocele. Meningocele is basically the meninges are the ones that are protruding and is filled with CSF. So there is no nerves there. So that one is called meningocele. And then where there are nerves coming in also, so in this case, this is the severest form, we call it meningomyelocele. And when we talked about it last time, spina bifida, one of the things that causes it, we think, is deficiency of folic acid. And that is why during pregnancy, many mothers are given folic acid as supplementation, including, of course, iron. Yeah, so that is the reason why we give folic acid. Mostly you should give it for a mother who is preparing, who is planning to conceive. You should be able to give them in advance, even before pregnancy. And of course, during pregnancy, you should be able to give folic acid supplementation. This one helps prevent development of spina bifida. And severe cases like the one meningomyelocele will actually result in symptoms like fecal incontinence and even urine incontinence. And even it can result in paralysis, somebody not being able to walk because of the severity of the nerves being entrapped in meningomyelocele. And of course, the flow of the CSF, if you are to look at it, you can see the way it flows all the way to finally end up in sinuses. Those are, it end up entering the veins. Yeah, so it has to be able to circulate. That is the normal circulation. So if you block it anywhere, in a child, you are likely to develop hydrocephalus. In an adult, you develop maybe headaches and other increased symptoms for signs of increased intracranial pressure. This is just another diagram showing the normal flow, how CSF flows. So if it is blocked at any point, then you develop symptoms and so on, if you are to block it anywhere. So it's important to know this normal flow, because if you are to block it at any point, then you end up with increased intracranial pressure. So you can see areas, it can block at any point. Yeah, at the cerebral aqueduct, you can have a blockage. You can have a blockage at anywhere in the fourth ventricle. So at any point in the flow of the CSF, you can have it blocked. And so if you are to block, for example, in the second diagram, you end up having dilated ventricles because basically the CSF have been dammed. So for example, if you make a dam, the water will accumulate in that point. And so in a child, you end up with, for example, hydrocephalus. And you can see that diagram there. Basically, that diagram, the A is a normal skull. This is in a child. If you're looking at a child, that is a normal skull. The head, the appearance of the head, normal head appearance. And then the second one will be in hydrocephalus. So in a child who has maybe the CSF is blocked for one reason or the other, the lateral ventricle markedly increase. And because the sutures are not yet closed, the head expands. So that is hydrocephalus. So B is hydrocephalus. C is microcephaly. That is the brain is very small. So there was a maldevelopment of the brain during development. And the C is microcephaly, the D is molding. Molding what happens during. So when a baby is born, because the bones are able to overlap each other because the sutures are not yet closed, it is able to mold. That is, it's able to cram towards each other, so to allow the baby to come out. And so some babies sometimes are born with the head appearing like that. That one is called molding. Yeah, and that I'm sure you'll be able to talk about it when you go to maternity, when you do obstetrics and gynecology, you will be told about molding. And usually with time, molding will be able to resolve itself. So after a few days, the bones will be able to return to normal appearance. And so that one will not be a permanent feature, the molding. So those are different appearance of the normal hydrocephalus, the microcephaly, the small head, the brain, the small brain, and then you have the molding. Yeah, so I think that's what we will leave it at that.